Great. Okay. Thank you so much. We have a great group today to talk about a really, really important subject and something that the Buteyko method can help. As you know, the Buteyko method is extremely good to tackle the root cause of all chronic diseases. Among the most pervasive chronic diseases that we find in our practice are those symptoms of an emotional or mental nature, such as anxiety, depression, and all kinds of alterations of our mood and our character. And today we have a great panel. We have today, again, Christopher, Vladimir, Martha, Marcelle, Nicolas, and we have Hugh back with us, who, as a student of the method, is going to ask our panel, who I would dare to say you comprise more than a century of experience with this method, and many of you have a lot of experience going through those symptoms, curing them with the method, and also treating them for many, many years. So I'll give the floor to Hugh so that he can ask his questions and tell us also about his experience as a student of the method on this regard.
Well, thank you, Javier. As a student, an admiring student of the method, I'm increasingly aware how much breathing bears on how we are all the time. And it's quite a tough ask to concentrate on one's breathing, but it certainly pays dividends. With regard to depression, I wonder if I could start by asking Marcelle a question. From your own experience of depression, Marcelle, would you say that the Buteyko method has helped you in contrast to that of medication?
Indeed, I have. I mean, I could leave it at that. Yes, absolutely, 100%, but that would lead to a bit of a short podcast. Now, I was 46 when I discovered the Buteyko method. I discovered it because I couldn't use my hands. I couldn't work. I was too tired to do manual work. And when I look back, I was a very melancholic child at the age of 9. There are dates by which I can verify that. As a teenager, I had a very low mood. I struggled at school to be sociable. The whole social side of school was just a misery for me. And then my father died when I was 15. And after that, nothing mattered. Everything was just so difficult and so awful. Life actually got kind of easier in a certain way, but my mood got lower and lower. And when I was at university, it was only courtesy of a very understanding department head that I somehow limped my way through vast tracts of time when I was unable to study, unable to think, unable to read, write. And I got through, and then I found myself in the working world. I hit the working world. And by the time I was 46, I'd changed careers at least 3 times as a result of breakdowns when I could no longer function at all. So when I came to the Buteyko method at 46, having also moved country in an effort to find a new life, I found my depression came with me. And so I had another breakdown. And then when I couldn't work at all, as a result then of fibromyalgia, chronic fatigue, and a number of other things had developed, I was very surprised that after 1 month of Buteyko practice, I was talking to my psychotherapist, whom I had seen for 12, 15 years, amongst others over the previous 25 years. Well, it was a 25-year process of pharmaceutical drugs, cognitive therapy, counseling, physical exercise, all the therapies I could discover and afford, dietary changes. And within those 4 weeks, I had found that I needed nothing else but the Buteyko practice. At the end of my 4 weeks, I had an emotional trauma through which I got myself, with the support and teaching of the senior practitioners, Martha, Christopher, and Vladimir, which was quite extraordinary. If I needed to read something difficult, I could do some practice with Buteyko Method, and I could read and understand what I was looking at. Anyway, I got through that, and that all had a happy ending. But I found that there was no more need for any experiments with pharmaceuticals, which had only, well, apart from my very first dose of antidepressants at the age of 21 or 22, I had some relief. I remember the feeling that even now, things felt a little bit better the next morning. But since then, everything was just no use at all. But Buteyko Method has brought not just the ability to work, to engage with social life, and to have some sense of future, and to wake up glad that the day has presented itself, a new calm and peace of mind, a new confidence that whatever happens, somehow I'll find my way through. And the whole timbre of life has changed. So I would say the Buteyko Method helps depression.
Thank you, Marcelle. Chris, could I ask you a question, or Vladimir for that matter? Because the word depression, some people say they're depressed when they're just having a bad day. But if someone comes to you and says they are depressed, can the Buteyko Method help me? What do you say? Do you inquire into the nature of their depression first, or what?
No, roughly we can divide, you see, 2 cases of depression, right? No, say first depression, like there is no materialistic reason behind it. And Buteyko Method helps people to get rid of this kind of depression, see, completely. Another kind of depression due to some materialistic reason. Some bad thing happens, okay? But Buteyko Method can help to regain composure and maintain it, can help people to think logically and to find better solution under difficult circumstances, more efficient solution, and can help people. Buteyko Method can help people to liberate themselves from negative emotions. Usually they follow depression.
I found it's the same thing, but I would have, in my own way, put it a little differently, because Vladimir is using the description and the idea according to the patient, depression and all these sorts of things. I would look at it more not so subjectively or on behalf of the patient, because I don't think the opposite to depression is happiness. I think it's either truthfulness or not truthfulness. And if you are onto something which is truthful, then you won't be too happy and you won't be too sad either, because it's all inevitable. And there should be agreement with the nature of things, you know. You are fire. Fire doesn't get burnt by fire. Water can't be drowned by water, you know. So I came to the conclusion that yes, people felt lighter, brighter, happier, and so forth. Why? Because maybe some suffering came off in terms of physical symptoms. Maybe the mind became a little clearer, which is very helpful, of course, you know. And I found that depression is some kind of damage to the mental process. But Vladimir's right. There's obviously two kinds of depression, because if your mum passes away, or your child passes, or you lose a lot of money, or there's a war on, or something horrible like that, well, of course, you know, it's a depressive type of reaction, which is kind of normal, to be upset or to feel loss. But if you're depressed for no reason, just a general darkness, a general gloomy outlook, that I find is not due to a lack of happiness so much, but more to that some unreality, some fabrication, some lack of logic somehow was the problem. You know, I found that Buteyko Method, the more you tried to investigate the nature of the self, the more Buteyko Method would help you. You know, if you wanted to go, you might actually happen upon it without any investigation, just because you've been practicing. But if you're interested to research it and be interested and be intellectually satisfied somehow, the Buteyko Method was a big help. And that depression was just like a mistake, actually. It's a wrong kind of thinking, that's all. It's not to do with much else, unless there's some, I don't know, some brain infection or material thing or poisoning, or okay, that's different, you know.
But it has to do very much with the way that the person who comes to you breathes, does it?
Oh, yeah. Oh, for sure, 100%, 100%. That's what I've seen. And a lot of sighing going on. Oh, geez, ooh, not good. Ooh, you know, and this is, of course, losing a lot of carbon dioxide.
May I ask, in terms of the biochemistry of carbon dioxide, is it the effectiveness coming via the balancing of hormones, or the synapsing of brain and nerve cells becoming more efficient? You've spoken of the mind, or is it a combination of the
combination? It's, you know, we actually make an error, not an intentional error, but a natural error. When we isolate hormones and neuron synapsing and this law and that principle, and we can sound so clever, you know, this oxyhemoglobin dissociation curve and the pH shifting to da and the d da da. It all sounds very impressive until you realize there's 50 or 60 or maybe 100,000 other mechanisms all whirring away. You know, if you were going to go into the minutiae, you wouldn't even, there's not enough paper and pencil in the world to write how a fingernail grows. Never mind how does, you know, brain function. It's too complicated. So, but yes, of course, hormonal imbalance is a big deal. Yes, of course. And sugar level is a big deal. And the rate at which neurons synapse with brain cells is a big deal. They're all big deals that you can see there, and you can see improvement in these things. But there's too many mechanisms. I don't mind to explain, to use examples. Look at oxygenation and look at this Bohr effect, or look at this, the research work on how the breathing affects the rate at which neurons synapse with brain cells and how orderly the synapsing occurs according to level of CO2. It's an example of the correctness of the idea, but it's not really a proper gauge as to what's going on, because the complication is to the wazoo, you know? And so you can actually be overconfident or have an oversimplified opinion somehow. But I noticed when dealing with psychiatric patients and all that kind of stuff, they tend to breathe well, actually. You look at a really crazy person, breathing is nice and light mostly, except every 8 seconds, 7 seconds, 10 seconds, they take a deep breath. Very deep. They're not panting. They're not No, they're not like that. They look normal, in my estimation, my observation. But every maybe 1 minute or every 30 or 40 seconds, they take a very deep breath, very deep.
Yes, that's been heard on the radio quite often when one is listening to anyone speaking on the radio. That happens a lot. But with regard to what you've been saying, with regard to depression, there are other factors involved, but breathing would be a good start. So one would recommend the Buteyko method to someone who was in a rut or depressed.
Yes, 100%. Without any hesitation, because even if there are other factors making trouble and even causing problems, when they do pauses, they will get respite, even if it's a short time. I want to meet the very depressed person, and I push them into some pauses, and within 10 minutes, 15 minutes, they're smiling already a little bit, and they're not depressed now. It will come back in 10 minutes or 15 minutes or half an hour, but at least they taste some, like meditation, maybe. I mean, maybe it's a bad example, but at least when you're in the meditation, you're somewhat relaxed, or you're somewhat still and quiet, or immediately after you might feel some, effect, so at least there's something related there. And so as soon as a person gets their pauses up, already they begin to start to get a little bit of relief here and there. That's what I've seen.
Perhaps I could ask Martha, who I've heard working as a practitioner, and she speaks quite a lot about being overwhelmed and how the Buteyko method can help one deal with feelings of overwhelm with regard to one's condition. Is that a fair question, Martha? The Buteyko method can help you dealing with feelings of overwhelm?
Well, the approach is that these feelings are symptoms of carbon dioxide deficiency. So the control pause is low. It's always low. When I came to this myself, my control pause was 10. And I came with the weight of the world on my shoulders. So, when I started to practice, this weight gradually came off bit by bit. And of course, at times I wouldn't do the practice because the overwhelm was so great, I couldn't remember to actually do the practice. This is another point about people that have got lots and lots of symptoms, is they don't practice. So they actually need supervision. They need someone to ring them up and ask them how they are, like Christopher used to. And they'd send me off to do a few pauses, and then I'd go back to him and he'd say, "How are you?" And I'd say, "I feel a lot better." And that was routine. But it happened time and time. I mean, he laughs about it. I'm a joke because I was always being caught out not practicing for symptoms. So I was a culprit of that situation. But that's very common amongst students, is that the one thing we try to emphasize and get across is not just to practice your routine 4 times a day as prescribed in the beginner workshop, but treating symptoms. And treating symptoms is not the same. Like, you may get into a real rut and you can't get your pause up past 15. Well, that's what it is. In your set, maybe you could get to 45, but if you've got depression, or you've got overwhelm, or you've got some sort of mood drop, heavy mood drop, can't get to 15. So that's it. You got to 15, you recover your breath, you take a break, you go again, and you grow the numbers up until you reach a suitable dose of CO2 where the symptoms have improved. And then, as Christopher said, it'll come back on again. Maybe 20 minutes later, you're doing it again, but then you'll get a little bit higher and you'll feel a little bit better. And so it goes. And with the encouragement of somebody who's not in the middle of this melange of misery, they sort of coax you along and hold your hand, or you push them along and get them moving, or send them out walking and then come back and do some pauses, something just to get the thing moving. so that they get the CO2 level up.
Melange of misery is wonderful.
I remember Martha. I mean, there was like so many students. You'll find that, I don't know if Vladimir experienced this, maybe, I don't know, but I sometimes, not all the time, but you would get a lot of a certain kind of student. It's like a lot of diabetes, and then you don't get diabetes. Now it's chronic fatigue. They come in runs, kind of, sometimes, you know. And I've been through a few runs of all this, like these people depressed and this and that and so forth. And I'd never understood really. I know what the meaning is, objective, subjective. I know what it means, but I didn't really see it in real life until I realized that these people were not stupid, or some of them might have been, but mostly they were not stupid. So they're sick, do some pauses, within 5 minutes, feel better. That's it, right? Okay, they forgot, we do again, they do some pauses, they feel better. But there's something wrong when you're dealing with someone like Martha. And this is the 15th time. Hello, Martha, how you doing? Overwhelmed. I can't cope very good. I'm very weak. All right, shall we do some pauses, Martha? Do some pauses. 10 minutes later, how do you feel? Oh, better, much better, thank you. I feel quite good, actually, I'm okay. It's like, okay, so, and again, tomorrow it's the same thing again. How are you? Not so good. You know, it's like, so there's something attacking something. Because if it was a sore foot that you had, you know, you got a cramp in your foot and you did a pause and the cramp went away. Every time the cramp came, you would do the pause and the cramp would go away. But when it's the brain, you can't remember to do it. Subjective, objective.
Well, you can't be bothered. You're apathetic. You can't get around to it. You need someone to.
There's no time. There's never any. You didn't have the time.
I didn't have the time. Is that right? Is that what it was?
That's how it feels. It feels like, I should do that, but I just didn't get around to it.
Well, one thing that I find remarkable about, which for us is obvious because we know each other, but for someone listening to this, what's remarkable is that you went through hell for many years, and then Buteyko worked in such a way that you became a practitioner of this. You're dedicating your life to help other people because this is what helped you, yeah? So perhaps, I don't know if Martha maybe can give us also a taste of what she went through, and also from Marcelle and Martha, could hear maybe something similar to what we heard from Joe once, who gave this enumeration of all the things that he had tried before the Buteyko method actually helped him. Because what transpires from this is that you went through a journey of many years where you tried everything, yeah? And then you did this, and it says, I'm not just going to practice this, I'm going to teach this, because this is the thing that helped me.
Well, I think that before you get to this, you realize there's no help. There isn't anybody out there who can help. And there's actually nobody out there who understands what you're going through. They think you're making it up. So you're on your own with this mess. And you're kind of, I was just reduced to screaming at the universe and say, look, you just send someone, you have to send someone to get me out of this, because this is dangerous. It's really, what's going on is not, it's not safe. So, and that's, somebody told me about Christopher, and after that realization that there wasn't any help, there was nothing that was going to help. And I had tried everything. I'd done the counseling, the cognitive behavioral therapy, I'd done the cranial osteopathy. I mean, you know, go on and on and on. I mean, I knew the counseling wasn't going to work, because every time I attempted counseling, I got furious. And I got so furious that I couldn't function. So I couldn't do counseling. That wasn't going to do it. I was livid about this situation.
But we should make at this point, it's not just depression. It's also bad temper. I never had depression, a little bit maybe, like when Vladimir said about things going wrong, but I never in my life did I suffer with depression, but bad temper, geez, I was just walking along, cool as a cucumber, crossing the road in Bondi Junction, Sydney, at a pedestrian crossing, and a taxi he must have released his brake a little bit, and his car just a little bit, and it hit me so softly on my leg. It didn't injure me at all. It didn't even scare me. And this hot blood just came whoosh like this. And I turned around and I kicked his car and smashed the headlight in. Yeah. And I became even more angry. And then this giant Maori, like these guys from New Zealand, he looked like the size of a house. He got out of the taxi and I thought, fuck it, okay, right. For self-preservation, I will just go away. But I had a very limited time when I could function, because unless I can't function in the morning, that's not possible. Crawl out of bed into shower, sit in shower, in the hot shower, and then can't do anything until I go downstairs, have coffee. And then I have a breakfast at 10-ish or 11-ish. My maid will come in and prepare for me. Now about midday, I think I'm okay. I can work for about 3 hours or so. And if my schedule is interfered with and you get in my way, I will smash your head in. That's how I felt all the time. On the verge to I never did anything violent, like with somebody, but that was the feeling that was there, very strong. I sacked my entire company once. I had 22 people and I sacked everybody.
And hired them on next day.
They all came back the next day because they knew. Bad temper, unbelievable.
So I'd say that the process, from my experience, it was in layers, and it was loads of it. It was years and years of some sort of a cumulative effect, and it would gradually get pushed out as I was doing the pauses, and day after day after day after day, you just work away, and gradually you're relieved of the burden. It goes, and it's no longer there. So now, mostly, if I get into a bad mood now, it's about something that's happening now. It's not about something that happened in the past.
It should be materialistic reason, right? And it doesn't last for a long time, for sure.
No, it's quick. Whereas I'd been carrying this around all my life.
Yeah.
If you want to talk about history, my mother was clinically depressed as soon as I was born. I was born and she became clinically depressed. And then 3 months later, she had electric shock treatment. That's my inheritance. It's just something that happened very early. I was brought up by someone with clinical depression.
So you just described the process. So something happens in the nervous system, right? So when Vladimir talks about materialistic reason, what he means is something real that is happening to you, to which you're obviously reacting.
Because you're a human being, right? Or your friend gets in trouble, or your mother gets very sick, or the car blows up. You're not pleased about it, and it has some effect on you. Fair enough. It's kind of logical in a way, a little bit. I mean, or something very sad, you have some emotions, you're still a human, but we're talking about a mental disorder. And I was just going to say that in psychiatric terms, going back 100 years, there was only 3 or 4 psychiatric diseases. Hysteria, what is it called? Like a manic depression, mania. That's it. Melancholic. That's it. Yeah. And now these have been developed because they've made a business out of it. Now there are thousands of psychiatric disorders. These people are breeding them like chickens, they're making more and they're writing books about it. And yet there's another psychiatrist, lie on the couch and tell me about your dreams. You know, they've made a profession out of 3 diseases, no one which can find any evidence for, all behaviorally based. And it's like, that's what it is. And as soon as one sees a little clearly, it doesn't mean you're happy about things. You may be facing your own demise, your own death. You're looking at it. But you're looking at the inevitable. You knew this. Your whole life, this day is coming.
But the great thing about the method is that first of all, you can become free of it, which is extraordinary because everybody's telling you that you'll never get rid of it and that you should be medicated or you should this or you should that, and nothing works anyway. And then if something happens and you get a bit disturbed, you know what to do. You've got a skill to treat it.
I went through executives, lots and lots of executives in Singapore, right? Because I lived in Indonesia, but I would go to Singapore because to do visa regular stuff. And then I started a business in Singapore. And the Singapore Chinese, forget it. You can't even talk to them. They're not in breathing, forget it. The expats I went to, and they're all executives. They're all work for Swiss banks and institutions, and they're all under pressure, and they're all drunks, and they're beating their wives. They've got emotional problems, psychological problems because of the pressure that they're on to make vast amounts of money and make all these difficult decisions. And I remember when I went to Singapore, I met this guy. I can't say, had to sign an agreement of non-disclosure, but he worked for a very important Swiss bank, and I met him. His wife knew about Buteyko Method because she was Australian. He was English, and they lived in a beautiful home. They looked like the ideal couple. They could have featured in a woman's magazine as ideal, happy couple. He's handsome, she's gorgeous, beautiful house, millionaire, young banker in Singapore. Okay, fine. And she said, her husband's got a few problems. I think the Buteyko Method will help him. And I met the guy. He looked me in the eye, shook my hand, come in, everything's normal. You look like a normal, nice, handsome, good guy. I'm thinking, what's his problems? And she said, well, he's got some psychological problems. And we've had some issues, I said, what issues? Well, he threw his chair out of a window, and the window is on the 30th floor of a building. And he threw his chair out the window. And then he was drunk and driving. I said, well, drunk driving, I mean, maybe the laws are a bit strict, No. He was paralytically drunk and driving at 140 miles per hour and arrested by the military and taken to the brig. It's how dangerous. But because he's a banker from a huge banking corporation with many connections, they try to not put him in jail or deport him because like that. And yet when I met him, he's a perfectly reasonable, nice guy, And so this pressure, and as soon as he learned shallow breathing, he liked it, not because it cured his behavioral explosions, but because he liked to watch other people's breathing, and he could control his emotions so well in business meetings. And that's the art of banking. When you have to be quiet and still and calm and relaxed, you have to make your breathing shallow. So I can say something to you and your face is calm, but if your breathing increases, and that's how a yogi can tell about you. He'll talk to you about many subjects if he's skillful, and he'll mention a certain subject, and he watches your breathing, and he'll say, yeah, well, yesterday I dropped some money, and the term money comes up, and your breathing changes. Your face doesn't. You're smiling, oh yeah, but your breathing change. And he'll do it again and again, and he'll eventually isolate which things bother you. He said, you've got money problems. So you're like, oh, how did you know? Because every time he used the word money or infers it, your breathing doubled. That's why it was used by KGB. And that's why it didn't work, because the KGB was so happy to learn a method where you could control your pulse. We all know that. We can control our pulse. We can control our emotions. We can control our eye movement. We can control micro expressions through breathing. So for a KGB spy, Buteyko Method is the best. Make shallow breathing. You can do many things and under interrogation. But the problem was that as they became better and better at Buteyko Method, they're not interested in doing that work anymore.
I think that's a great story. I can definitely relate to that. When I, as an artist, my way of controlling my nerves was, and by the way, these things that you're talking about, so we started with what's considered sort of like an illness, right? It's like mental illness, but it applies to actual normal and more everyday life emotions. And we all go through that, and we're not considered to be sick, right? Because we're not causing problems around. But a lot of people have a compulsive behavior, or just like the typical obsessive thought, that just the typical melody that you can't get out of your head. I'm sure, like, I know you know what I'm talking about. Like a song gets into your head, you just can't get rid of it. And but the Buteyko,
And they're terrible songs.
It's the
It's
worst
not
one.
the good
Yeah.
songs. It's the garbage songs. It's money, 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 or this ABBA stuff and things like that, you know. When you're near me, can't you hear me? So I can still hear the bloody thing. And I hated that song.
Yes, and you wouldn't go to a psychologist or a psychiatrist for these kinds of normal, everyday life annoyances of your own mind, right? But everybody goes through that, and the Buteyko Method actually helps with all of those. If it helps with someone who has depression or has anxiety that is clinically already diagnosed and all of that, so imagine what you can do to just overall well-being, yeah? And this is certainly my experience also, that I was up and down. You know, I didn't feel sick, but I was up and down emotionally, and things affected me. I thought I cared about what other people might think of me, never mind what they really thought, is that what they might be thinking of me was important to me. And these are things that just disappeared. And I remember the specific moment, because I was an opera singer, and always to calm myself down, I will do deep breathing. I was big into deep breathing, you know, because all my singing exercises were deep breathing. And as soon as I thought, oh, you mean it's the opposite, that if I just calm my breathing and I stop my breathing, then that's what's going to get me to control those emotions, like stage fear and being nervous about a performance or anything else. And I remember the exact moment where I experienced that for the first time, that stopping my breathing actually just calmed me down. And I was like, oh my God, you know, I've been doing it wrong for so many years. And it's just so simple. It's not about breathing more, which I think everybody does that. Everybody who doesn't know the Buteyko Method does exactly that. It's like breathe deep, you know, keep calm and keep breathing deep. Yeah, as they say in the T-shirts of that they sell. And it's just the very opposite.
Stalmatsky tried to convince me to do Buteyko Method, and I said no. And he said, but you're willing to put money into this and you don't want to learn. I said, I must remain objective. I must remain objective, because it's like a cult, you know. So to remain objective, I'm not going to do it. And at that time, my Crohn's disease was not acting up and I was okay. So he couldn't answer. He couldn't say anything, you know. But I did complain to him and said, you know what? The cigarettes, I'm getting a bit of a chest cough, you know, like from cigarettes. But I don't know what to do, because I quite enjoyed smoking, and I'm going to have to. And Stalmatsky said, if you learn Buteyko Method, you can smoke and not have the cough, you know. So I said, okay, I will do a few. I did a few pauses. And then I could go back from Marlboro Light, which I hated, back to Marlboro Red, which I liked. And not have any irritation in I know that's the truth. And it was actually the ability to smoke which kept me going with Buteyko, started me off, if you can believe that. I don't tell that to everybody, but that was the truth.
We should mention that thing about the state of nervous system, because for people who don't know Buteyko, their breathing usually deep. A deep breathing makes nervous system overreactive. That's why even a little trigger factor is enough to flare up nervous system. if people see practice,
threshold of excitability, they call it.
yes, because nervous system will be in calmer state, much calm compared with, you see, people who see breathe so deep. That's why you see people see sometimes, like you said about Stalmatsky, sometimes he did know. He writes a question, should I be angry? No,
Exactly. He was insulted. They insulted him at an asthma meeting. We had a meeting with the Asthma Foundation. And because there was a lot of publicity and they had to meet with us. And they said something which was, he didn't understand it because his English wasn't good enough. But it was very insulting. And he knew it was insulting, but he wasn't absolutely sure. And he looked at me, should I be angry?
Emotions later. With high control pose, there's some gap. Something you see comes, for example, nasty you see think, but people with high control pose, they have time to think about first. Oh, you don't know me. How you can see, describe me like whatever, okay, bad person. No, because people have time to think about, right?
Also, if you are not angry and you want to look angry deliberately, you are 10 times more angry and scary.
Yeah,
Stalmatsky had a very good technique. He can go into a room with many people in the room, 6, 7 people in the room, and he can lower the temperature of the room, make everyone feel awkward, or make everyone feel happy. Why? Because he could do that because he would provoke on purpose to see. And he had many, he sometimes he used to hum. Bloody hell, I want to choke him, you know, sometimes. You know, we would be driving along somewhere and he's humming. It's like, stop it, you know. And you check the threshold of excitability. And so you can talk to someone, you just mention something and you see their reaction and you know straight away what's going on.
Yes, and with high control poses, emotions, positive and negative, will be servants. And some people might be skillful, like Stalmatsky was. See, other way around, if people have a low control pose, they are the emotions, they can't think properly, they can't use logic because, you see, they are the emotions, all right? Emotions control them.
And this thing of excitability of nervous system goes much deeper than you think. Stalmatsky once said to me, like, because we talk about serious things, asthma, medications, diseases, running a clinic, potential problems with doctors, all this kind of stuff that we are dealing with in the early days. And then the topic would change and he would get into the more mystical stuff, which I did not appreciate. And I don't mind a little bit talk about it, but I don't want to talk much about it because, and I felt that it sort of took away from the more serious things that we need to concentrate on. But I remember he did one time pique my interest when he said, you know, with Buteyko Method, you can disappear. And I said, but disappear where, you know? He said, well, people can't see you. And I said, yeah, okay, right. And he said, well, you know, he said, I said, then show me. He said, nah, it's not like that, you know, because you know I'm here and we're discussing the thing. But I can make it so I'm not visible to you. And I just laughed and said to him, do it. And he laughed and said, oh, you know, you'll see. And so we changed the subject. My office was, my desk faced the door of the room. There was no way to get into the room of my office except in front of me. You can't sneak in my office because I'm in front of the door. And I'm working there doing my shit, you know, whatever. And Stalmatsky's standing behind me. It scared the shit out of me. Because I didn't see him. What, he crawl through or what? It's impossible. I can look at my door. I can see the hall down there. How did he come in? I have no idea. And he later told me that you walk at a certain pace and you control your breathing very well. And you don't attract the energetic attention. So
Yes,
you don't catch their eye. And I practiced it. I practiced it in immigration department in an airport, and I nearly got all the way through, except there was a barrier there. I am able to walk just because I slowed my pace down. It became uninteresting. And no one looked. And you could walk right past. I used to do it at nightclubs. I would make my breathing very shallow and go very close to people that I knew, and they didn't see me. And I'd say, hey, how you doing? I go, oh yeah, hey, how are you? But I could always sneak up on people, go right next to them, and they not notice I was there. Just by became a hobby, became a fun, like a party trick, you know.
But again, please, just simple. Low control pose means people breathe so deep. Under stress, during stressful situation, they breathe even deeper. And deep breathing makes nervous system so overreact, and people have negative emotions at the same time. And combination of deep breathing and negative emotions is detrimental to health.
Vladimir is using this word, negative emotions, but under the word is a huge, big mess, right? And this negative emotions at their essence, it's the development of neural pathways whereby through habitual practice, you interpret things incorrectly. And the incorrect interpretation comes because neurons are not synapsing in an orderly fashion.
Yes.
It's not logical. It's not truthful. It's not making sense. And this idea, even a stupid idea, but very thin, like a piece of string, can be broken easily. But if you repetitiously wind it again and again and again, it becomes like a strong rope. So you're dealing with illusion. Because I talked to Stalmatsky a lot about what Professor Buteyko was like a lot, you know, and what he said and his situations and so forth. And so many times, according to Stalmatsky, Professor Buteyko's answer was always the same. We have what we have. We've got what we've got. That was the starting point. We have what we have. And people are people. That seems to be his habitual, you know, anchor point. We have what we have. Some deep agreement, no fantasies involved. And these fantasies are very dangerous and damaging. Hope is the one that's leading to disappointment. Why would you have hope for? A stupid idea. You're making hope, you're going to create your hell. If you don't have a hope, but you look at the practical situation, what you've got, the best you can do with what you've got, and try not to become too engaged in any outcome, not to be attached to outcomes. And everyone who is any kind of skillful artist knows you can't be attached to outcomes. If you're a golfer, don't think about the prize money. Think about the shot that you're making now.
Absolutely.
If you're a singer, you don't care if the audience likes it or hates it. You're giving it your whatever you're doing, right? If you're thinking about if they like you or not, forget it. If you're a comedian and you're concerned if they're going to laugh or not, you're no more a comedian.
If you make some poem for yourself, it will be good poem. If you're doing for somebody else, it should be bad. Yes. What the Buteyko method can help people to get rid of any delusions and illusions, to live in reality now. And of course, without shallow breathing, it is impossible. Many points, okay? Nervous system will be calm, in peace, in calmer state, much calmer, like solid, okay? Difficult to irritate somebody who has a high control pose, all right? Secondary, all right? Thinking, more logical. Overwhelming for me. It's like mess, emit thoughts, right? Mess. People think about that, then about this. They can make order. They can't use logical thinking because, okay, let's think about this. Stop. Now we solve this problem. Now think about that next. Okay, make an order. People can't make an order. That's why they have lots of thoughts and they can't solve any problem. I don't know what it means, overwhelmed.
Quite often they can create more problems.
Yeah, sure.
By the way they make decisions and the way they respond, how they behave, it creates more problems.
And they lose confidence, composure.
Well, they're going to victim. There's a victim
The
thing.
victim, yes, many, you see, whatever.
Then you can't actually deal with any kind of conflict at all. You can't, so you move away from any conflictual situation because you can't handle it. So you go into a kind of protective mode.
Yes, that's why you see Buteyko method can help people to live, come back to reality.
Well,
And,
they can become less limited. They can actually do more. As you get iller and iller, you do less and less.
And, you know, and there seems to be the interpretation on defense is actually attack. The more they try to defend themselves, it doesn't result in defense. The best form of defense is attack. And that's the wrong view that arises. And so people become very fierce. I remember I was in England and I was on a roundabout and I didn't really cut the lady off, but I kind of nearly did. And then I realized that I was wrong. And so I slowed down and I waved at her, said, oh, sorry, you know, I was like a bit the wrong way, but she's already doing this. And I thought, okay, nice. You know what I mean? I'm like, sorry, you know, and she's
already showing the finger, yeah.
Yeah, I know. I'm thinking to myself, boy, you know, she's not in a good mood. Well, road rage is a good example. And I had, that's why depression and anxiety and being overwhelmed and being bipolar and all these things, I lump them all together in the same lump. I don't, yes, of course, you've got to strategize a little differently, but they have the same genesis, which is deep breathing, and the same mental, some disturbance, and eventually they can have this brain vessel sclerosis. If you are, you know, having overbreathing for many years without any relief, you end up with getting even worse. But all those mental, I had one guy who's like a violent criminal, quite famous in Australia, and he's a well-known guy. I was terrified, not terrified, no, I wasn't, but I was a bit concerned when he came to the clinic. I thought, oh boy, you know, this, you know, this, can't use him as a testimonial, you know. And he had what do you call it, nasal headaches, like this sinus headaches, very painful. Very painful stuff, this shit, you know. And he did his work and he's a serious guy, reasonably friendly, no problem. And he came in 2 weeks later after the workshop was finished and he was in a good mood. He was okay. And he said, how's the nasal headache? He said, oh, fine, make pause, it's gone away. And I said, oh, good, nice to see you, you know. He said, yeah, but I came here for another reason. He said, I'm getting teary. I get tears sometimes. I said, what, is it irritation in the eye or what, you know? No. He said, it's tears. I get teary. I said, from what? He said, I don't know. He said, I think of my mother or some thoughts come up and I feel, you know, my eyes fill up with water. And I said, well, yeah, it's just some release of emotions. He said, it's not good in my profession. I can't be like that, you know, because he's a gangster. You can't have a gangster having emotional breakdown, you know? And I said, well, it won't happen when you're in those kind of situations. He said, you sure? I said, no. When you're by yourself, you might get teary, but if you're in a conflict, you won't get teary, don't worry. He's all right. And he kept on practicing, and that he said he got in rages. He got in violent rages, but he said, I don't know who I should, but somebody I should, you know, smash to pieces, but I don't know who. And what should I do? I said, stay at home. Don't go out, stay home, it'll pass. And eventually it did pass. And then some years later, I was at an airport and he approached me and he told me that he's opened up a new business in the Sutherland Shire, the south of Sydney. And I said, oh, that's wonderful. What sort of business is it? And I thought it'd be a nightclub or brothel or whatever these sort of guys do. And he said, it's a plant shop. He's selling plants. I said, great. I mean, that's a business for a gangster, isn't it? You know, selling little cactus plants and flowers and things like that. So, okay. So he changed his career path, it seems.
Maybe dope in the soil and the plant.
Maybe, yeah, maybe selling
Dope, yeah.
So we have also Nicolas here with us. Nicolas is my colleague. We teach the Buteyko Method in Spanish. We've been doing for slightly over a year now. And we've seen some cases of anxiety and depression. And yeah, because it comes from the mind mainly, right? It's very effective, but it can be tricky, can it, Nicolas? So tell me if I'm right on what I'm going to say. What I see is like when people are doing best and they're having the results, then the mind kicks in and says, no, this Buteyko thing, something's wrong with it. You know, it's too much. Is whatever excuse comes up, it comes up, and they have to, you know, tell you that, and you have to work through that to see if you can find a way through. So what do you think of that, Nicolas?
I think that sometimes the biggest obstacle for a student is they are too greedy. They want too much to be healthy. And this wanting too much makes them breathe deeper and makes their nervous system through the roof. So many times, yes, it's the biggest obstacle. And it's better for people who are just trying and not very concerned about the results, and they just do it. But yes, with people with severe anxiety, that's a big obstacle. They want too much to see the results.
And they
they're
get very
greedy is the problem. Greedy is the root of everything. Greedy. Deep breathing is the expression of greed.
That's very interesting.
Even some people push themselves too much doing maximum pose, and they should pay later for that. Again, greediness like that, even not good.
Yes.
Yes.
Yeah.
So Martha, you were saying something.
Oh, well, they get disappointed if they don't get what they want as well, because they come for a particular thing they want to get rid of. And it isn't necessarily that thing that gets sorted out straight away. Lots of other things get sorted out. And then this particular thing that they're concerned about doesn't get sorted out as and when they think it should be. So whatever it is, whether they get what they want or they want what they want, it's tricky. Whether if they don't get what they want or they are looking to get what they want, it's a problem. It doesn't do.
And don't forget that the body becomes disabled, and it became disabled through some wrong behavior, I say behavior, but I don't mean socially. I mean breathing, physiologically, thoughts, whatever. So you reverse this problem and you bring them back to the same juncture they were before. And if they repeat the same idea again, so you got some businessman, greedy. He wants, you know, to control and own everything, right? And now he's sick. So he does pauses and he feels better and he's stronger and he starts to incorporate it in his life and doing good. And he's doing very well. And then he come back to being greedy again and it become more difficult to practice. And so the same thing will come again. He will do this a few times, maybe, until it's like this again, and again, I go down the same. So you have to jump train lines, you know, because you actually made them better so they can damage themselves. They made themselves better. So they now have an opportunity to damage themselves again. doing the same old things. Yes.
Like Buddha said, maybe in next life he can succeed.
That's right.
Someone said that, you know, Nisargadatta said everything is becoming cured. Everything becomes cured by itself. And someone said, but what about when the patient dies? He said, sometimes that's the best cure.
Great. So that answers it. We also have Liona join the meeting a little bit later. So I don't know if Liona, you want to perhaps tell us about your experience as a practitioner with the Buteyko method in regards to anxiety, depression, and all these conditions, or if you have anything to say about what you heard so far.
Thank you. It's Liora. So nice to see you. I want to say first that I enjoy very much the podcast. I listen to them, and I'm even exciting to hear that you can bring every time a subject and deal with it so clearly. Happy about it. So you some kind of jumping the publicity of the Buteyko method in this way. So it's good.
Great.
Maybe I will say that in Israel, I don't know if it's just in Israel, but people here searching for fast results, and they have doubts all the time. They don't believe in anything, but they believe in everything. So it's not easy to keep going with them. From all the students that did the workshop in Hebrew, maybe, I don't know, around 50 during the time. There are few, very few, that keep doing and keep being in touch. Nobody agreed to come to intermediate. No, one or two did, but mostly they are not continue with the other workshops. They don't come to when I try to do some kind of follow-up meeting to see what's going on, no. But if I'm in touch with them, few of them are my students. I'm a yoga teacher, so some of them coming to the classes, so I can see where they are. Few of them doing the practice during the yoga. They even sit in the beginning or in the end, in the corner, and doing the poses by themselves. I cannot really say exactly how it's go in Israel, but most of them keep something from the method, and they appreciate very much what they know. So I hear like evidence from people that, for example, I was in the MRI examination or something like this, and the method helped me so much. I didn't feel the time. I was very calm at the dentist. So they use it, but they don't keep doing as we hope they use it more. It's funny because I had now a vacation. I didn't work for a month and a half, and this week we came back. And the first class, suddenly I noticed that it's very quiet. I don't hear any noise of breathing. And then I go over all of them, and I noticed that all of the students did the Buteyko method some time ago. So I mentioned, in the end, I told them, today all of you are Buteyko's students, and it was amazing because it was very quiet. They control the breathing all the time. They use the shallow breathing, and they didn't make any noise.
Very good. So they can get a lot more than one realizes. We know that they can get a lot, but some people get a little, and that little is enough to take off a lot of misery.
Yeah, I think that speaks a lot about the perception of the practitioner himself, that we might be very critical with the seemingly average results that we get, but actually we might be getting, and I think that's the actual real experience, much more than we think. We had an experience with one Spanish student who showed up to the workshop, good student, but nothing remarkable about her practice or anything. She came to a free follow-up 2 months later, control pose of 50. And I was like, this is incredible. She had been working on it without too much making any noise. She said she didn't send any reports. She didn't say anything, but she came to the free follow-up and control pose of 50 at the end of the session. And she was like, I feel great. I have so much energy. It's incredible. And I was like, wow, well, you should have told us, because we want to hear about this. So yeah. I would like to finish with, so we started with Marcelle, and I would like to finish with Marcelle, because actually the testimonial you gave, I think it was very much to the point and quite moving, I have to say, at least for me, because it shows the reality of what you were going through. And I guess I want to touch upon what I asked Martha and Marcelle at the beginning is, you didn't just practice, you decided to become a practitioner. So maybe you can comment on that. Maybe we can do some end comments to finish the podcast. Maybe Hugh wants to say something, but I would like to, first of all, ask you that, and then we finish with some closing remarks.
Picking up on what Martha said about liberation, I had two liberations. One was when medical and every other approach failed, and I was told to go away, do whatever I was doing. By the way, that was apropos a rheumatologist who said, do what you're doing. I don't want to know what it is, but keep doing it. And the other rheumatologist said, exercise, exercise, exercise. And at that point, I knew I was on my own, as Martha experienced. And then I was still going through all the various things. I desperately tried to get some symptomatic short-term relief, short-term meaning maybe 5-10 minutes, anything to get some relief from the range of symptoms. So when I did discover this, when I did meet Martha, I thought I want to be like her. There was a solidity about her, and to my astonishment, she knew what I was going through. I'd never met anybody who knew what I had been going through. And Christopher was there. I started my training when I was invited to do so. Without question, there was no question ever. It was just the thing to do. What I had been trying to do at the time I discovered the Buteyko method was teach children yoga, children who had autism and that kind of condition, because yoga was the thing that would help me most up to that point. And when I discovered Buteyko method helped me even more, that was what I wanted other people to have, because the grief and suffering, not just to the individual, but to everybody they encounter, family, friends, and the whole waste of life, that inability to function effectively, to contribute anything, that's before you get to any sort of pleasure or enjoyment of life. And I was just furious that other people suffered so much unnecessarily. So it was just the thing to do. There was not a question, a debate, and that was it. And I'm very grateful.
Makes a lot of sense. Thank you so much, Marcelle. Hugh, any closing remarks from the point of view of a student of the method?
Well, yes, just to say that I said at the beginning how aware I become as not a very good student of the method, but certainly a student of the method. I've become aware how much breathing bears on how we are all the time. And I see it's a no-brainer, really. And people just think breathing's something that they take for granted, when really it needs to be concentrated on all the time.
And I think another point that's really important is that with Buteyko Method, you're changing the chemistry. You're not doing some mechanical physiotherapy type exercise. You're not doing something physical as such. Well, you are, but the physical effort that you put in is to change your chemistry, is to get your chemistry right. It's a completely different premise. And that's what inspired me, because a lot of the things I'd done were just fiddling around with moving this thing and moving that thing, some sort of physical mechanism. But this changes your chemistry fundamentally.
If I might just go back to Hugh's point about watching your breathing all the time, one of the obstructions to that is that when you practice the method, you sit down quietly and you do shallow breathing. Fair enough, nothing wrong with that. But did you practice shallow breathing when you're walking? Well, that's different. That's not the same. And what about shallow breathing when you're walking upstairs? And what about shallow breathing when you're with someone that you're comfortable with, as opposed to somebody you're not so comfortable with? Breathing will change. And you're watching television, breathing will be different. You're on your computer, breathing will be different. If your conversation is about politics or this or that, it might be different than if your conversation is about something else. So then going back to what you said, watching your breathing all the time, it sounds so simple. I mean, what could be simpler? It's not launching a satellite or something. It's not a complex algorithm to calculate. Just watch your breathing. Yeah, but your breathing will change, the pattern, the breathing pattern will change according to many, many factors, or many factors will exert some influence. So your ability to control it will also require different method or different approach somehow, different mechanism. So that's where it becomes a little bit, and you think you forgot, you didn't forget. You were distracted away, because many times, how many times, I'm going to watch my breathing. Right. Air hunger, fine, good. I will do some work. Something on the computer, make a phone call. Ah, shit, I forgot my breathing, completely out. Try again. Go back and forth, and you realize a phone call, a disruption, a certain kind of thinking, looking at something else, certain kind of conversation, breathing is gone. And your watchfulness of it with it. And so to remember that and to keep on coming back always to the idea to make that feeling, slight feeling of air hunger with a relaxed diaphragm.
So that seems to me very helpful, because I've been to so many social occasions where I've thought to myself, I'm going to approach this occasion watching my breathing. And the moment I open my mouth to say, hello, how are you? And let's talk rubbish for 5 hours. I've completely forgotten about my breathing. Completely forgotten about it.
Yeah.
Great. Well, thank you so much for your time, for the enthusiasm that you put in on this project. I think it's great. Really grateful for it. And so thank you, Christopher, Vladimir, Martha, Marcelle, Nicolas, Liora, and of course you. And I'll see you in the next one. Remember, you can find us in learnbuteykoonline.net, and you can have free webinars, and you can sign up for the courses, visit the website, look at all the testimonials, listen to all the podcasts that we're doing, and we'll catch you on the next one.